Hey, are we live? I think we're live. Hey guys, Dr. Zubin Damania, aka ZDoggMD. We're going to do a live show to the whole page today. It's March 20th, Friday. And we're talking about, obviously, I don't know what's in the news in our minds and in contagion in our brain right now. It is the COVID-19 pandemic. So let's take your questions and we will talk through where we are right now from a healthcare perspective, from a community perspective, and from a problem-solving perspective, because we're in that phase of things now where we need solutions. We can start by saying this is the most effed up response, early response to this thing that could possibly have happened. And so now we're in a position where we have to deal with the results of a lack of early testing, a lack of early aggressive containment instead of late aggressive containment. And I am in California, that's where we're broadcasting from, and that is a state that is now, the entire state is on lockdown. And the reason is, what they're seeing is the increased trajectory of new infections that are starting to pick up and pick up and pick up in a way that you would predict would exponentially happen from the nature of this illness, which is a 2-week incubation period. So before someone even gets diagnosed, they're having early symptoms, they're potentially spreading the virus, infecting up to 4 or 5 other people per the reproductive number of this virus. And so what we're seeing where we are now is actually not, you have to extrapolate where you're going to be. And that's why I think Governor Newsom in California instituted the aggressive measure of basically now shutting the whole state down. And we can talk about the nuance of that, but I think let's first kind of get to where we are right now. And thank you to everyone who's sending stars and supporting the show. That helps us keep the lights on. I know it's difficult economic times, so don't feel compelled to do that, but it does help us do what we do. So we're in a state now where we're seeing increased prevalence of this, of course, without aggressive testing. And I, again, get hundreds and thousands of messages from people around the country by every platform that I have that are basically telling me the same thing. I had symptoms, I couldn't get tested. I had patients who had symptoms, they couldn't get tested. The turnaround for the test is either, undetermined or too long. And so we're not getting accurate data of where we even are in terms of prevalence. And I think the Italians were in a similar situation. The Koreans, South Koreans, were the opposite. They quickly tested as many people as they could, thousands and thousands of tests even per day, and had an idea of what was going on, so then they could take appropriate measures. And it's culturally different too, so people might actually listen to the measures instead of, and I said this early on, maybe a couple months ago, that the kind of aggressive measures that they took in Wuhan, China, even would never fly in the US, because Americans would be like, wait, why am I doing that? I don't need to do that. And so too little testing, too late instituting measures, and now we're in a situation where the only option, it appears to the government officials, is to shut down everything. Now, as we know from our patient population in general, adherence to recommendations from anybody that is in our own mind it's low. So it's going to eventually require enforcement, and it's going to get pretty dicey for a while. But right now, the best thing we can tell people is stay inside, social distancing, wash hands, so that our frontline healthcare professionals can do their job, which is start to continue to spin up the response to this. Now, this is the second piece that I'm hearing from all around the country. Healthcare professionals, and I am talking LVNs and nurses and CNAs and MAs and doctors and health systems administrators and all kinds of people, because remember, we're all on this in a team. I like to rant and rave about failures of leadership and so on, and all of that is true, but let's be honest. For the leaders that are doing the best they can, we are in this together, and we better start behaving like a team. What I'm hearing is a complete and utter lack of a personal protective equipment resource strategy and allocation approach that it doesn't seem draconian, like locking it all up and having providers use the same mask all day. I mean, this is what it's come to. The CDC itself had to put out revised guidelines because of science? No, because of necessity, because they don't have enough personal protective equipment. So it had a hierarchy. Now, this has been misreported, I think, with a lot of hysteria. Like, CDC is saying to healthcare professionals, use bandanas and scarves. That's not what they said. They said, use this. If that doesn't work, use this. If you don't have that, use this. If you don't have that, use this as a last resort. If you have to see a patient and you don't have any PPE, use a scarf or bandana. Now that is a sign of, again, desperate last resort. And it points exactly to the situation that our frontline healthcare professionals find themselves in. Now I did a video the other day talking about there are people in the public that are spraying nurses who show up in the grocery store with Lysol. A nurse got punched in the face outside of Walmart because people are afraid that they're contagious. If you do that to a frontline healthcare professional, any healthcare professional, that is a straight karmic ticket to being on a ventilator and then dying on a ventilator. That is the karma that you get when you behave that way, because these people are doing their best. Imagine being a frontline healthcare professional, right? You don't have masks. You're told to see patients when you're sick, because that's another thing that's happening now, even in New York. Oh, you got symptoms? Well, put on a mask, wash your hands. Oh, by the way, we don't have enough tests to go around. Oh, you tested positive for COVID? Maybe after you stop coughing, go back and see patients. That's how desperate the staffing situation has become because of the complete crap show that the planning for this turned out to be. And by the way, when all this is done, we're not doing it now. When all this is done, if we don't hold every single leader in this country of every party and every stripe accountable for this fiasco, then who are we as a people? I mean, I'm going to be honest with you, between you and me, guys, this is the spark that will burn this shit down. This screw up here is going to be the spark that burns this system to the ground, and what comes after it is going to be much, much better. And I'm not talking about revolution or anything like that. I'm talking about people are going to wake up and realize, oh, we don't even have a healthcare system. We have a system of siloed, for-profit, crony capitalism. It's not even real capitalism with competition and price transparency. It's a bunch of crony garbage that's supported by government and supported by crony large monopolies. But that's a whole nother discussion for another time. But this will be the spark that burns it down, because people will realize it couldn't keep us safe when push came to shove, when little kids who break their arm or someone who needs cancer chemotherapy can't be seen because every single hospital bed is overflowing with patients from this crisis that could have been at least tamped down. We could have flattened, it wouldn't have even been flattening the curve, it would have been actual containment early on, right? Instead, we're following a trajectory that looks more like Italy than South Korea. And the Italians are older, so we're seeing a lot of mortality in Italy. By the way, guys, let's take a second. We're very self-centered here in the U.S. We're, ready, staring in the eye of a Category 5 hurricane bearing down on our system, and we're preparing and we're spinning up, and instead of being anxious and scared, we're getting prepared. But at the same time, let's not forget our colleagues around the world who are suffering through crazy stuff, you guys. The Italian healthcare system, the Chinese, these guys are heroic. And actually, so the Italians have really good, robust healthcare system. And I've heard from people on the ground in Bergamo, these really central hit places in northern Italy, and they're saying, you guys can't even imagine what it's like. And in the midst of that, do you know what they're telling me? They're telling me, we are praying for you, America, because you are a great country and you need to get prepared, and we're rooting for you, and here's some advice, and here's what you can do. They're thinking of us, so let's think of them, guys. So that being said, it reminds me too, when you have a coronavirus jumping from a bat somewhere in China and affecting the whole world, we remember that we're all deeply connected. We are one thing, really. And until we realize that, we're going to behave like we're not. And when we do that, that's when we fail. So speaking of one thing, now we're back to a situation where our one so-called healthcare system, which is really a series of little fiefdoms and silos, it's a non-system, now has to respond to this. Now, who's that falling on? It's falling on our frontline healthcare workers who are really scared right now, you guys, because they don't feel safe. What happens when they have to go home to their families and they're worried they're going to make their families sick because they didn't get appropriate protection, right? These people aren't really worried about themselves. They're worried about others. And that's the nature of the selection bias that affects people who go into medicine in the first place. They care about other people, right? So let's think about them before you punch one of them in the face in front of a Walmart, you piece of crap. What is wrong with you? Right? Sometimes I think, America is getting what it deserves if that's how people are behaving. But then I remember there's a negativity bias in even our reporting. We're seeing the worst being shown to us. What we're not seeing is the daily heroism, the love and the kindness, the respect in the lines at the supermarket. The cashiers and the people who work those lines at the supermarket are going to go down in history as heroes. Can you imagine? I saw when they announced the shutdown, I went to the supermarket because my kids needed milk for the week. And I stood in a long line very patiently, and everybody was patient. And there looked like there was a 70-year-old bagger at the supermarket. And he was working, right? Because that's the wealth disparity in this country as it is, right? You're working when you're 70 to make ends meet in a part of the country that's impossible to pay the rent because the young tech people are jacking it all up. And he's standing there, and there's lines of people, and he's touching people's stuff, and he is exactly in the risk demographic of someone who would die on a ventilator alone in a hospital if he got coronavirus and the system was overwhelmed. Think about that for a second. All right? Now, the other thing I want you guys to think about, first of all, how are we going to spin up enough personal protective equipment? We're going to be talking to people on the show for the next few days. By the way, we're going to probably have Peter Attia on the show, recording on Sunday. Hopefully we'll show it to you on Monday. We're going to talk about what he's learning, talking to all the experts about this and what he's telling his own patients, how we're handling this. And he is one of the smartest people I know, so you want to get the big brains around. We want to talk about different phases of response. So it may be that right now, this is the appropriate phase to just absolutely clamp down. But then the question is, once you pull that back and infections start to come back, should we be thinking out of the box? Should we be thinking, let's look at the demographics of this. The people who are dying are 60 and over. Now, a lot of people can get infected, including young people, and we're seeing that, particularly in the U.S. We're seeing, a fair number of younger people, 40 and under, that are getting infected. Now, the question is, what's their mortality? And I suspect it's actually going to be much lower, and they may have some other comorbid illnesses. They got other diseases, but typically the people that are dying are older, right? So in the second wave, doesn't it make sense to start considering different options, like sending younger people back to work, saying if you want to go, go. And what will happen is the vast majority of them will get infected and will have minimal symptoms, because that's what we're seeing, right? Minimal symptoms, and we'll start to develop a community immunity to some degree, right? Now, people have talked about, well, Britain had this idea of doing that. No. They were going to let everybody develop community immunity, and that would kill something like 5% of every American over 70 if we did that, if we just let it go. So this isn't frozen. You don't just let it go. You have to be smart. So after the initial kind of clampdown, you can say, okay, maybe we ought to, because listen, guys, a zero economy output is a fatal scenario. People will die without the economy running. You will destroy the resiliency of the country. You cannot do that for prolonged periods. And this may be an 18-month process. So maybe you have to start talking about different ideas, talking to experts and epidemiologists who some have weighed in on this and saying maybe that means younger people go back, the vast majority of them will be okay, and you keep the oldest and most risky under real extreme social distancing, right? You test the hell out of everyone that you can so that you know that if there's somebody caring for their grandmother or grandfather, they're getting tested the first sign anything's going on. And at least then we have a sense, too, of prevalence, and we can make better decisions instead of shutting everything down on a blanket long term. Now, short term, we have no choice now because the horse is out of the barn. And at this point, we don't have scaled up testing. We're beginning to see the trajectory that will overwhelm our hospitals, right? Now, something that I want you to understand, there's 8,000 people watching right now. Something I want, and by the way, thank you to everyone who's donating stars. It really does help support the show and people who become supporters. One thing that nobody's talking about, and if they're talking about it, they're doing it in hushed tones. I'm not going to do it in hushed tones because one thing I want you to get out of this platform is I will always tell you the truth as far as I know it. It may not be right, but I'll tell you what I think, all right? If you are an individual over the age of 60, if you're an individual over the age of 10, 18 in this country, and you haven't had a discussion with someone you've chosen to be your decision maker if you can't make decisions, or filled out an advance directive, or filled out a living will, or talked to an attorney, whatever it is. The simplest thing is pick somebody and say, you're my decision maker. Write it down somewhere. Tell your doctor, tell your care team, this is my decision maker. They put it in the electronic health record. And then you can tell them, hey, if I get so sick that I need a ventilator, you can try for a couple days. If it doesn't look like my trajectory is good, I want you to make me comfortable, be by my side if you can, and let me pass. Or I want everything done unless X, Y, and Z. Or I want everything done. You tell them now. If you haven't had that conversation and you die on a ventilator, taking that ventilator, when your wishes were not to be on that ventilator, taking that ventilator from a young person or somebody who really could have turned around and gotten better, you're a dick. Plain and simple. So this is my call to action on that. Have the conversation. And the other question we need to be asking ourselves, if you're 90 years old, should you be on a ventilator? In a crisis situation where we do not have enough vents, where your statistical probability of dying under torture is nearly 100%, should we, as a country, as a people, as individuals, as healthcare professionals, entertain the possibility of intubating a 90-year-old person? And again, these are conversations that you have in medical ethics committees and hushed tones and isn't that rationing of care? And this, no, this is called what you do when you do not have enough resources and you have to make difficult decisions. What do you think our colleagues are doing in Italy? They're having to make these very same decisions. And people are asking questions like, how long are advance directives good for? Listen, you wouldn't have to ask that question if you have a decision maker who you can point to and say, that's the person that makes decisions for me. Now, be careful who you choose. If you choose someone who's so emotionally attached to you that they will not respect your wishes if you tell them, I don't want this or that, they go, I can't let him go. That's not who you want. You want someone who's going to respect your wishes. And a lot of times that's not your closest family, it's somebody else. So think about that. If you do one thing after watching this show, talk to your loved ones, talk to your parents, talk to your children about what the wishes are, what their wishes are, what your wishes are. Because guys, this is true, COVID be damned. This is just something that we have to do, period. And now it's getting acute because if you fill up those ventilators with people who really didn't want to be there or who have very little chance of surviving, you save those ventilators instead for people who will turn around. This is the thing about young people. If they get sick, the chances of them recovering because of their innate resiliency is much, much higher than a 80-year-old diabetic hypertensive with heart disease. It's going to be a disaster, and their recovery, you don't even think about the rehab component and the time involved and all the nursing homes getting full. We're already have minimal excess capacity in this country because of the way the healthcare system is designed. And that may have to change in the future to allow for surge in a different way. And I've been very hard on leadership in this country, and I think that's appropriate, but at the same time, we're going to have to work with these people to actually make it better, unless we burn the whole system down, which is, again, another talk. This is the spark that may do it, guys. The world is not the same. The world isn't the same as 2 months ago when I first started talking about this, and I said, guys, you know what? This is not as big a deal as we think, but we have to just be extremely vigilant, test everybody, make sure. Then that doesn't happen. Now we're where we are now, where I'm having a conversation like, hey, have you had an advance directive discussion yet? Think about that, all right? Now, one thing about the psychology of this that I think is very important, because we're getting into that. Thank you for everybody who's donating stars. And as Elise Lerner, who's a Lehrer, who's a supporter, says, we're entering combat triage time. Hard decisions have to be made. It's heartbreaking, but it has to be done. That's right. We are in a war. And by the way, people who would say, well, would you send young people then back into the workforce knowing that a few of them will die of this disease? The vast majority won't. You have to think, like, how many times have we gone to war? Who do you send to war? You don't send your elders to war. You send the young people because they're able to handle it better. That doesn't mean it's the right decision. It doesn't mean that it's a good thing to do. It doesn't even mean I feel good saying it. But you have to, and I consider myself one of those young people who would go back, even though I'm 40, going on 47. This is what you do in times of crisis. And so we have to see the first wave of this in the US. How bad will it be? Now, in absolute numbers, I've always said that the public is actually remarkably safe with some mitigation strategies. It's the frontline healthcare system that is going to face collapse, overwhelm, doctors and nurses and respiratory therapists and dietitians and pharmacists getting sick. That's the main failure point, right? And then what happens is general society doesn't get its basic care. And that's going to be the biggest problem. But again, we will get through this. This isn't the apocalypse. We shouldn't be running through the street. Understand the psychology of this. We've instilled in the public so much fear, and yet it's not fear enough that people don't behave the way they still should. So they're still out in public doing stupid crap, going to the beaches in, Florida. That is the most idiotic. If you took a yearbook of the apocalypse, right, the actual apocalypse, that's what people would be doing. You'd see pictures of idiots on the beach, ding-dongs going to bars. Hey, I'm immune to this. Yeah, that's like an outbreak movie, right? Where a horror movie where people do stupid things and they all die because of it, right? Don't do that. But the truth is, it's our healthcare system that is going to suffer the brunt of this, right? And that's the group, honestly, that I feel like the most kinship to, because that's my tribe. So we're going to fight tooth and nail to make sure that we are not overwhelmed, right? Because of idiotic decisions made by leaders everywhere. So that being said, let's take a look here. Oh, sorry, the psychology of this. It's like a contagion, a social contagion, this thing. Do you guys feel it? 3 months ago, we were entering a new year. Now it's hard to spend a waking moment without thinking about this weight that's pushing on us. Now, if you're already marginal in terms of your anxiety levels and mental health and so on, if you live on the margins of society, if you're a high-stress professional, this is going to push you, guys. A good example of this effect I experienced myself. So I consider myself quite calm and very balanced about this, and I think about it as rationally as I can, but I'm still a human being and I get emotional. You guys have seen me scream and yell about this stuff. Now, when, hey, do you want to come and sit with me? No? Okay then, close the door or else sit with me. My baby, see, everybody's at home. Now this is the evening, but all day, every day now we're with our families, we're in tight quarters. And honestly, for me, it's been great, but it is stressful, right? It's stressful for many people now. So here's the psychology. I consider myself generally well balanced for the most part. I go a little crazy once in a while and I have my own problems, but I consider myself a rationalist. So I thought, okay, we're going to keep talking about this. We're going to spread education. This is my mission. My wife is there reading chest films. She's a chest radiologist at Stanford. She's there on the front lines helping. We're doing our parts, right? Last night, the kids had finished all their homeschool stuff, and my wife had gotten home, and we'd had dinner, such as it was. And we sat and we pulled up Disney Plus because we heard they're releasing a bunch of videos in a rush way because they know everybody's at home. And I was like, oh, I appreciate that. Okay, cool. I bought the subscription, pull up Toy Story 4. I hadn't seen Toy Story 4. So it says 4K, Toy Story 4. I'm watching it with the kids. We're listening. We get immersed in the movie. And this is the thing about movies. They take you out of wherever you are and they put you in a totally different headspace. And so for the hour and a half or whatever the movie was, I was in a totally different headspace, and I was there with my family. We're one unit experiencing this, wonderful movie. It was really enjoyable and very well done. And so the minute the credits stopped running, I experienced something remarkable, which was the transition state from being lost in an immersive, selfless experience where the little ego that's always worrying and planning and doing a lot disappears and you just are the movie. And that's what meditation and chanting and prayer and whatever your practice is can do. It takes the self away and makes you really part of something that's totally not you. And I felt that relief and wonder, and then zoom back into the self, the construction of ourself. And guess what? Oh my God, there's a COVID pandemic going on. What are our frontline healthcare professionals going to do if they don't have enough masks? what show should we do tomorrow to try to help spread the word and raise awareness and outrage and get things done? And you feel the societal contagion start to squeeze down. Now, the reason I talk about this is because it was so clear to me in that moment that we can be of two different mindsets. We can be paralyzed by worry and concern and the small sense of a self versus a hostile world, or we can feel that expansive, hopeful connectedness that will prompt wiser, thoughtful, rational action, right? Where we listen and feel our emotions, but we don't let them control us. We don't lose ourselves in them. We don't identify with them, right? That's what we need more of right now. That's why I'm doing less ranting and raving right now and more talking with you guys. So let's read some comments. Vani's falling asleep in the East Coast. I must be that boring, huh? Too much meditation talk. This is called suspension of disbelief. It's a great tool to utilize, Courtney Graham. Yeah, in entertainment it is. But I actually would argue it's one step further for movies. It is a loss of self. So you no longer apply a observer. You are lost in the movie as the movie in a really good film. And I think it's a good analogy to what you can do in a flow state when you're doing something you love, in meditation. There's a lot of different ways to attain that. The choice we make in this moment will affect everyone in the future. Distancing isn't necessary for ourselves, but for those who need protection. Stay home, follow directions, and we may have a fighting chance. Olivia Montgomery. We will. We're gonna get through this, guys. We will. The worst case scenario is we lose a lot of vulnerable people, right? We overwhelm our healthcare system, and then in a few months, there's a collective immunity. We have a vaccine. We're working on treatments. By the way, so whether it's Kaletra, hydroxychloroquine, whether it's chloroquine and azithromycin, whether it's remdesivir, there are things that people are working on. And the other theme of this, as we wrap up here, is, Gina King says, I'm scared to go to work. The hospital took our masks. Gina, if you weren't scared to go to work when the hospital locks up your mask and you don't get enough, I would be worried about your sanity. It is absolutely rational that we should be feeling safe, right? Absolutely rational that's what we ought to feel at work. So remember that we're going to get through this. We do need to take these measures in the short run and then really look at the data. We need to science the crap out of this. This is a chance for science to rise to the station that it claims to hold, which is the savior of mankind in general. When something like this happens, our scientists go rushing in, trying to solve the problem, and they're working on it, which means we have to give them the time to do that, which means we have to do the social distancing and the lockdown and all the other stuff that we have to do in the short run. But remembering that we're counting the cost of that. Every day you deprive a young family of their livelihood, those children are endangered. You end up costing lives. So it is a trade-off, which means we do need to ask tough questions as we move forward about who goes back to work, when we do that, how we do that, and what are the risks, right? And if you don't have a conversation about your end-of-life wishes today, right, I'm going to be pissed because that's irresponsible. It's as irresponsible as going out on the beach in Florida or hanging out in a bar with your friends when they're asking you to lock down and shelter in place at home, right? Which sounds crazy, but honestly, that's going to sound crazy at the time, and it's going to look like it wasn't enough if we don't do it right. So it's time to actually do these things, okay? So any other comments here? My daughter's 7 months old and has hydronephrosis. I'm scared to bring it home as well, right, Lorianne? I mean, we're all afraid of hurting our families, and this is a huge dynamic, right? And it's causing a lot of stress. And if you don't think like heart attacks and the like of stress-related chronic disease is not going to boom after this, it really is tough. But now, let's remember one thing. This is a globe and a country that has been through a lot worse. And we can get through this. We can get through this too. And it just means that we have to really hunker down and expect things to get harder before they get better, and talk and be rational and be emotional together and stick together as one human tribe that we are. All right, guys? On that note, I want to thank the 25,000 star givers. The top star givers are D. Wells, Alex Roseman, Bryce Johnson. Each gave over 1,000 stars. And we get a penny per star, which means it goes into all of this and support and keeps us commercial free as much as we can be, and so on and so forth. So thank you for what you do to keep us safe. Thank you for supporting what we do by sharing and liking and commenting and leaving your frontline reports here. And you're right, Sylvia Cummings, on a positive note, there's going to be another baby boom. So prepare. We're going to have plenty of workers in the future. All right, guys, I love you. We are out. Stay safe. Peace.